It's hard to believe it's been over 4 years since our world was turned upside down. But how exactly did we go from a mysterious illness in one city to a global lockdown and then back to a new normal? Let's take a look at the full story of the coronavirus pandemic. Our story begins in late 2019. In the bustling city of Wuhan, China, doctors started seeing patients with a strange and severe pneumonia. Many of them had a connection to the Huanan seafood market, a place that didn't just sell seafood, but also live wild animals. Chinese authorities moved quickly to investigate, and what they found was a new type of coronavirus, which they initially called 2019 CoV. The disease it caused was named COVID-19, and the virus itself was officially designated SARS-CoV-2. It was a cousin to the SARS virus that caused an outbreak back in 2003, but with a terrifying difference. It spread far more easily between people. Early evidence suggested it may have originated in bats and then jumped to humans through another animal, though even today, the precise origin remains one of the pandemic's biggest unanswered questions. As 2020 began, the situation escalated rapidly. In January, the virus was spreading like wildfire across China. On January 23rd, the government took an unprecedented step. They locked down the entire city of Wuhan, a metropolis of 11 million people. It was a move that shocked the world, but it was a sign of what was to come. Just a week later, on January 30th, the World Health Organization declared a public health emergency of international concern. By February, the virus had broken its borders. Cases started popping up in South Korea, Iran, and Italy, which quickly became the new epicenter of the outbreak. The United States also reported its first cases. Then, on March 11, 2020, the WHO made the announcement that everyone had been dreading. COVID-19 was officially a global pandemic. What followed was a moment frozen in time. Governments around the world began closing their borders, grounding flights, and issuing stay-at-home orders. The great cities of the world, Paris, London, New York, fell silent. The familiar hum of daily life was replaced by an eerie quiet as millions of people were confined to their homes. The spring and summer of 2020 felt like something out of a movie. Almost every country on Earth entered some form of lockdown. Schools and universities went dark, sending students home indefinitely. Restaurants, cinemas, and all public gatherings were banned. Face masks went from being something only doctors wore to a mandatory accessory for a trip to the grocery store. The world's economy shuddered to a halt. The phrase "Yuri on mute" became a global inside joke as millions began working and studying from home via video calls. International travel simply stopped. The sudden shift created chaos. Supermarket shelves were stripped bare of essentials like toilet paper and hand sanitizer. Hospitals were overwhelmed, and a global scramble for masks and medical supplies began. Millions lost their jobs or watched their businesses collapse overnight. But amidst the fear and uncertainty, there was a glimmer of hope. Scientists around the globe united, collaborating at a speed never seen before. The race was on to develop a vaccine, our best shot at fighting our way out of this crisis. The pandemic wasn't just a health crisis, it was a deeply human one. Life changed in ways we never could have imagined. Families were separated by closed borders and quarantine rules. The elderly, the most vulnerable among us, were isolated in their homes or care facilities, cut off from their loved ones. For many, work and school became a screen in the corner of the living room, as we all joined the great migration to Zoom. But in this time of isolation, human creativity found new ways to connect. Musicians and artists held concerts from their living rooms, streaming to a global audience hungry for connection. Social media platforms like TikTok exploded in popularity, providing a much-needed source of entertainment and shared experience during the endless days of lockdown. But behind the memes and online concerts was a grim reality. By the end of 2020, millions had been infected, and the global death toll had surpassed a heartbreaking 1 million. As 2020 drew to a close, the scientific community delivered what can only be described as a modern miracle. In an incredible, record-breaking effort, several effective vaccines were developed and approved in less than a year. The world was introduced to new technologies and names: Pfizer-BioNTech and Moderna, with their revolutionary mRNA vaccines. They were joined by others like AstraZeneca, Johnson & Johnson, and the inactivated virus vaccines from Sinovac and Sinopharm. In December 2020, the first shots were administered. It was a monumental moment. The vaccination campaign began with those who had been on the front lines, from day one: healthcare workers and the most vulnerable, our elderly population. It felt like the beginning of the end. But the virus wasn't done with us yet. Just as vaccines began to roll out, new, more contagious variants emerged. First came Alpha, identified in the UK, then Beta from South Africa and Gamma from Brazil. But the one that truly changed the game in 2021 was the Delta variant, first detected in India. Delta was a formidable foe. It was far more transmissible and caused a devastating wave of infections across the globe, pushing healthcare systems to the brink once again. Countries that had started to open up were forced to impose new restrictions. It was a frustrating step back. However, there was a crucial difference this time. The vaccines were working. While they didn't always stop infection, they proved incredibly effective at preventing severe illness, hospitalization, and death. The race was now between vaccination and variation. By the end of 2021, billions of vaccine doses had been administered, but the rollout was unequal, with many poorer nations still struggling to access them. Just when we thought we understood the enemy, it mutated again. In November 2021, scientists in South Africa detected a new variant that was unlike anything seen before. It was named Omicron. This version of the virus was heavily mutated and spread at a dizzying speed, faster than any previous strain. It was so contagious that it could infect even those who were fully vaccinated or had been previously infected. But Omicron came with a surprising twist. While it was incredibly infectious, it generally caused milder illness, especially in vaccinated individuals. This paradox, extreme contagiousness but lower severity, marked the true turning point of the pandemic. For the first time, it seemed possible to manage the virus without shutting down society. Countries began to change their strategy. One by one, mask mandates were relaxed, schools fully reopened, and international travel started to resume. The dreaded quarantine periods were shortened or removed altogether. The years 2022 and 2023 were about finding a new rhythm. COVID-19 was still circulating, but its power to cause chaos was greatly diminished. This was thanks to a powerful wall of defense built from vaccines, boosters, and natural immunity from past infections. We also had better tools to fight it, with effective antiviral treatments like Paxlovid and Remdesivir that could help prevent severe outcomes in higher-risk patients. The global strategy shifted from zero COVID to living with the virus. Economies began to roar back to life. Concerts, sporting events, and festivals returned. Airports were once again filled with travelers. Life started to feel much closer to the normal we remembered, even if masks and testing remained a part of life in certain settings, like hospitals. Then, on May 5, 2023, came the official declaration. The World Health Organization announced that COVID-19 was no longer a global public health emergency. It was a symbolic end to the crisis phase of the pandemic. The virus was still a health threat, but it no longer held the world hostage. By 2024, most countries had fully reopened their societies. COVID-19 had transitioned into an endemic virus, much like the seasonal flu. It was still around, and we would continue to manage it, but for most healthy and vaccinated people, it was no longer a life-threatening illness. The pandemic is now fading from the headlines, but it has left an indelible mark on our world. It forced our healthcare systems to improve and prepare for future crises. It normalized remote work and online education, changing how we learn and earn a living forever. The long years of isolation and anxiety sparked a much-needed global conversation about mental health. And perhaps most importantly, it taught us a powerful lesson about the importance of global cooperation, the incredible power of science, and the resilience of human connection in the face of adversity. The world before COVID-19 is gone, but we move forward with the lessons it taught us. Thanks so much for watching. If you found this recap insightful, please give this video a thumbs up and consider subscribing for more deep dives into the events that shape our world. Stay safe and see you in the next one.